The role of the veterinary nurse is wide and very varied, and involves many more tasks than most people think. A typical day can involve setting up kennels for the inpatients, making them comfortable and ready for our day's arrivals. All of our inpatients are met with one of our nurses to offer a warm welcome. First and foremost, it is the job of the veterinary nurse to go through the consent form and answer any queries about the procedure, before leaving them to settle in. The nurse assisting the vet will make sure that everything is prepped and set up for all procedures that are due to take place that day. The nurse will be the one who gets them ready for their surgery. This can include taking bloods if necessary, placing the cannula, and clipping and preparing the procedure site. During any surgery, it is the job of the veterinary nurse to monitor the anaesthetic closely and informing the veterinary surgeon of the patient's status. Once the surgery is complete, it is the nurse's responsibility to make sure the patient has a safe and comfortable recovery from anaesthesia. The nurse will stay with the patient whilst waking up, as it is a vital part of their nursing to make sure that the patient's key clinical parameters are within normal ranges. Once the patient is fully awake, the nurse will attend to any tasks that have arisen whilst being in theatre, such as packing samples to be sent away to the laboratory, carrying out urine testing as part of the clinical investigation, and recording all test results and findings on the patient's clinical records. Then it is back to the kennels for the nurse to give the inpatients a light lunch and make sure that they are eating and drinking as normal. Once all of the theatre has been cleaned and our furry guests are waiting patiently to go home, it is time to hop onto the front desk to help man the busy ringing phones. Over to the dispensary area now to get ready all of the repeat prescriptions plus any medications that the inpatients need to go home with. These will then be taken to the vet to be signed off. A bit of housekeeping is a routine part of the veterinary nurse's day and involves packing away food, medications and stock deliveries, as well as maintaining the waiting room area with adequate supplies. Then time to do the laundry. Keeping on top of all the bedding for kennels is a daily task. Consultations and appointments make up a large part of the nurse's day and are structured to allow time for patients and owners to come in for general healthcare help and advice. This can include weight management appointments, such as Lily here, flea and worming applications, nail clipping, microchipping, renal clinics, puppy parties, and much more. We hope that this has given you an insight to the role of the veterinary nurse and how crucial they are to the smooth day-to-day running of the practice.